these things should improve, and his lanugo hair will eventually just start to shed on its own. Yeah, so I am concerned that his nutrient restriction could potentially have adverse effects on his bone health. The age that he's at now is really the last time that he's able to actually accumulate that bone mass density. So I'm going to recommend that we ensure he takes not only calcium supplements, but also vitamin D, vitamin D3 to ensure optimal calcium absorption to deter any risk of fractures, which is unfortunately increased at this point as he hasn't been getting those minerals and vitamins. Yeah, so at this time, I think it is for the best that Mateo remain in the inpatient hospitalization treatment until that NG tube is removed. So while he's here, he's not only going to have access to dietitians, but he's also going to have access to the physicians as well as the behavioral health team. Yeah, and once that NG tube is taken out, he can downgrade to a residential type facility where he'll have support 24/7 with the qualified nursing staff. Yeah, so 24 hours a day they'll be able to assist him if needed. Yeah, it is a structured program. About half of the day we'll have planned programming, shared meal times. Some of them may also snacks. Yeah, so kind of getting them used to eating in that group setting. Yeah, so, having that professional support most, if not all, of the days of the week, it will be a safe space for him, and it will ensure that his needs are being met. Yeah, so in addition to the dietitians, doctors, mental health providers, there will also be physical therapists, if we need to work on kind of regaining his strength and, moving his muscles properly. Also, recovery coaches will also be accessible for Mateo to utilize. Yeah, so that could be somebody who's already gone through recovery. Yeah, so once the team and myself find that it's appropriate for Mateo to advance from this program, he can then transfer into a partial hospitalization or PHP. Yeah, the late afternoons will be off-site. However, the programming during the day, so this can occur anywhere from 5 to 7 days out of the week, just depending on the facility, the location. Yeah, so Mateo will need to stay in a transitional home. He'll be sharing a living space with his peers. Yeah, I agree. The support from his peers who's going through, the same process will be helpful. Yeah, so after some months of this living scenario, he could move into that IOP or intensive outpatient program. Yeah, that's a good question. So this will be a few hours each day, maybe about half of the week, give or take, again, depending on the facility. Yeah, exactly. So definitely a decrease in support. However, he'll continue to receive the care through his appointments with not only his therapist and dietitian, but he'll still work within a group therapy setting as well. Yeah, so most meals will be up to Mateo and the two of you, but there will be some food provided during treatment as well. Yeah, within the programming. Yep, that's part of it. Yeah, I understand your concerns about providing him adequate meals. However, you two will really learn, what is going to nourish Mateo. I am not fearful that you two will become expert field players. Yeah, so the last true segment to the recovery phase of the recovery plan is the outpatient setting. Yeah, so once he reaches the weight that's been agreed upon between, all of the team members, then he can move up into that outpatient program. Yeah, definitely noticeable shift in support will occur. Mateo will probably welcome this. It will, he'll get a little bit more autonomy and independence, which will be, a noticeable shift, but after all of these months, he might actually enjoy that. Yeah, he'll continue to meet with not only his therapist, but also the dietitian and the physician will still be involved. We'll keep track of his weight and monitor his progress. Yeah, because of his age, he may be placed with that recovery coach to kind of work with him for a bit longer. Yeah, so group therapy is typically discontinued. However, you could definitely continue if you or Mateo feel that it would be beneficial. I'm more than happy to provide you with the reference that I think would best fit. So if you want to reach out towards the end, and we can work on it from there. Yeah. No, I understand. There's a lot of different pieces to this process, but we're all very, very willing to help any step that we can. Yeah, so regarding the possibility of recovery, I do feel that through all of these sessions, he's meeting with that mental health provider, his therapist, myself, the rest of the dietetic team, the doctors on staff. Yeah, so I think he has a high chance of recovering quite well. Yeah, so the more invested the family is, the better treatment results he will have. Yeah, it's really important for the family to be nice big family unit for this. Understand. Yeah, so fortunately, while most of the complications Mateo has experienced are reversible, monitoring will still need to take place to ensure that Mateo is recovering at a proper rate. Yeah, so additionally, I recommend that he continue to work with his team to prevent a relapse from occurring, and then with those steps that he's learned throughout after that outpatient program, always checking back with his team if needed, or continuing to work with a therapist on his own afterwards, just to kind of maintain. Yeah, I agree. Well, are there any other questions before we invite Mateo into the room? All right, wonderful. All right, well, I'll go grab Mateo.